would all join me in rising for our invocation from Chaplain Charles Creech. Thank you, Lord, for the opportunity to come to you today as we consider the things of our hospital, our community, our people, the ones with whom you have entrusted us. I pray that you will give us grace, give us wisdom, give us the strength and stamina to do the things that we need to do. Help us to serve our community and love them as we should. And Lord, we ask you to do the things that only you can do. We need your grace this day and throughout our time. We ask these things in your holy name. Amen. Thank you. And next, our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I will call the meeting of the Sarasota County Public Hospital Board to order. I have a public comment to read. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in the meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. So next on the agenda is approval of the orders of the day. So I need a motion.
Second.
Any comment or discussion? All those in favor, please indicate by saying yes.
Yes.
Any opposed? That motion carries. Thank you. Next on our agenda is approval of the minutes of the meeting of November 20th, 2017.
Make a motion.
We have a motion and a second. Any comments or discussion regarding that? Hearing none, all those in favor, please indicate by saying yes.
Yes.
Any opposed? That motion carries. Thank you. Next, we have on the agenda board reports, approval of board committee appointments. Pursuant to our bylaws, the chair has made leadership appointments for the various committees of the board. I believe Ms. Susan Tucker, our secretary, has a motion to approve those appointments.
Yes, thank you. Item 4, paragraph A on the agenda, approval of committee leadership and membership. I move approval of the committee leadership and community and physician membership as appointed by Mr. DiVirgilio as the board chair.
We have a motion. Is there a second?
Second.
All right, thank you. We have a motion and a second. Any discussion or comments? Hearing none, all those in favor indicate by saying yes. Yes?
Yes.
Any opposed? That motion carries. Thank you. Next on the agenda is an update on the Community Special Clinic. Dr. Garner, I think you have an introduction, right?
Yeah, I do. I have the pleasure of introducing Dr. Ricky Wiseman. Dr. Wiseman's been here in Sarasota since 1981. He originally got his undergraduate degree at the University of Florida and then went on to get his medical degree at the University of Miami. He completed an internship and residency in internal medicine at the University of Virginia and joined us shortly afterwards. He's been working at the Community Medical Clinic in its various iterations since 1994, and he is here to give us an update on this very important service for our community. Dr. Wiseman, welcome.
Thank you. Good afternoon.
Good afternoon.
Not Dr. Wiseman, but that's okay.
Yeah. Yeah. Thank you. So the Community Specialty Clinic is at 1851 Arlington Street on the second floor, and we're on the southwest corner of the campus. Our mission is to provide free specialty care and referral services to residents of Sarasota County who are uninsured or underinsured. We started in 1992 with a group of doctors who got together and wanted patients to have a good holiday season, and this month marks our 25th anniversary. I'd like to thank the hospital administration and the board and everyone else who was involved in our recent expansion. This is a picture of our lobby. We now have 5 exam rooms. The doctors and the patients love it. And I invite you to come for a tour if you're in the area. Love to have you. Dr. Wiseman and I report to Dr. Fiorica. Our administrative lead, George Bommersheim, is here with us today. We have 5 other employees and 1 dedicated administrative volunteer. You have to live in Sarasota County to qualify for the community specialty clinic, and your household income has to be at or below 200% of the federal poverty guidelines. We take referrals from our community primary care partners, including the Department of Health and many others, and most recently, the Newtown Internal Medicine Residency Clinic. We also take referrals from any doctor on staff at SMH. We've had 4,200 visits this year. We've outsourced over 1,300 specialty referrals, and we've seen an uptick in our census in the last 3 months. In terms of gender, we mirror the demographics of Sarasota County. We have 55% female and 45% male patients. But in terms of ethnicity and race, we have a high Hispanic population and a high African American population compared to the county. On the bottom is the age group. We take 18 and over, and we predominantly see people in their 40s and 50s and early 60s before they're Medicare eligible. About 13% of our patients don't speak English and need a translator. The bottom of this slide is the zip codes from which our patients come. The right side is South County, Northport, Venice, Englewood, part of Englewood. And the left is everything from Vamo Road north to University. Our physicians, volunteer physicians, are our drivers. They're the reason we can give such high quality care. We currently have 16 doctors who physically come to our clinic and 156 specialists out in the community who take our patients in their offices. They weave them in and see them pro bono. All of our physicians have volunteer provider agreements that offers them sovereign immunity. On the left here are the specialties that we have in the clinic, and on the right are services that SMH offers our patients have access to, and all the specialties that they see out in the community. In 2017, we changed our name from Community Medical Clinic to Community Specialty Clinic to avoid confusion and be more reflective of what we actually do. We've doubled the clinic size. We've digitalized the entire clinic, implemented daily reporting, and along with Dr. Kucera, created a GI program where our patients now have more access to endoscopic procedures. At the bottom are the doctors who came on board with us this year, including Dr. Kyle Garner. Thank you. I'm going to turn it over to Dr. Wiseman now.
Wow, that's impressive. For 25 years. That's impressive. I think I told Catherine I'm getting ready for the nursing home. We're moving quite the speed of light here. So, you know, when you're caring for people, it's complicated. I think probably no one knows this better than you right here. The delivery of care, the referrals. It takes more than a village to get this accomplished. And often in this busyness, you can sometimes get caught up in that and maybe not lose your focus, but not always get to hear back from patients. I remember when I was helping my daughter and my wife prepare for her wedding years ago, I was very busy. I even learned how to tie a bustle. I was just trying to figure out how to make this all happen and the cake and everything. And one of my friends said, be careful that you don't miss the wedding, because you get tied up in all that. I wanted to read these. You'll just sort of oblige me here. I want to read these because I think it's important to read them out loud. These are some patient comments back to us at the clinic. The first one is, all the volunteer doctors and staff are wonderful. Thank you for taking such good care of me. I wanted to express my extreme gratitude for everything the clinic has done for me over the past several weeks. I feel healthy again thanks to your volunteer doctors. Thank you for always taking care of my husband and best friend. He passed away at Tidewell Hospice on November 22nd, but he was able to live longer and with much better quality of life because of each of you. Dr. Bright gave me a new knee and a new life. So when you hear back from that, you feel that you're doing the right thing. We have, learn how to use this here. Let me just see if I got it. Okay, great. We have some challenges at the clinic still. Not all services are fully representative. We've mentioned before that there's over 20 ophthalmologists in the community. We've actually, I think at one point in time, we're down to 2 or 3. We have 4 now. But there's a lot of diabetics who need their retinas checked for, retinopathy. And sometimes we just can't, when areas are underrepresented, there can be a backlog of patients. And of course, the existing people who are volunteering their time feel burdened with those number of patients. So we struggle with that. We don't have a rheumatologist presently. We don't have a nephrologist. And we get referrals for patients with connective tissue disease and chronic kidney disease. And so that's a big challenge, not having those specialties represented. Catherine came up with this first sentence here, and I certainly can't improve on it, but it's a digest or synopsis of what we do at the community medical clinic. It says the community specialty clinic, I forgot the name, the community specialty clinic provides high quality specialty care and free access to care for many residents of Sarasota County who would otherwise be unable to afford care. You see that access and affordability in the same sentence, and that's, is always the tough nut to crack for, I think, any community. And some communities who don't have a community specialty clinic are left to just have patients hit the ER when they're in crisis. And of course, it makes a lot more sense to try to care for those patients up front, to keep them out of the ER, and to provide them the care that they should have. The only way that comes about is through having a hospital support. It can't come by just hoping for the best. It has to have the hospital backing, and we're so grateful for that. Catherine estimated with a state formula about what value the specialists have provided in 2017, and it came out to be $1.8 million. That's the specialists. There are a lot of primary care docs in the community who see patients and write off the charges, but they know those patients can't afford an MRI. They can't afford other types of high technology care, and they're referred through our clinic. And they're able to get that information and then better care for that patient going forward. It's said that the secret of patient care is in caring for the patient. And I really feel that's the absolute truth. And again, getting back to my first comments, it takes a lot of partnerships, a lot of people working together, pulling the same direction in the yoke to care for people who are disadvantaged. I certainly work with wonderful people, and it's just really a real pleasure. It's also an honor to be able to take care of people. We really appreciate, again, the hospital support in this endeavor. It's been, just really wonderful to have it, and it makes a profound difference in the lives of others. And those comments from the patients show that. So thank you very much.
Thank you, Doctor. Any comments or questions for Dr. Weissman? So, Doctor, it's obvious your commitment and caring to the community, so thank you to you and your staff. We appreciate it. Thank you.
Thank you.
So next on the agenda, yes, I'm sorry, Mr. Henry.
Doctor, where do you get your machines, your MRI machines, and et cetera?
Well, we're talking about the hospital machines,
Yes.
okay? I have no idea where they get them from.
You send your clients here to use them?
Do I send my clients here? Yes.
Okay. You don't have one in your facility?
Oh, we do. We do, but I'm working within the hospital, you know, for these patients that I'm caring for here, and they come here.
Okay, you do have one in your facility, and we provide that,
No,
No.
you don't provide the one in my facility.
okay?
No. This is just one of the jobs that I do, being a medical director for the clinic here.
Okay.
Okay.
Our specialty patients utilize the radiology department at SMH, if that's your question. And
The
Dr.
question really was, how can we do a better job to help support the doctor's practice? The clinic.
So Daryl, so we work with them very closely, so their practice is on our campus. And so when they need an MRI or need some kind of radiology service or lab or whatever, we do that in the hospital.
Good, that's what I wanted to know.
Yes, sir. No,
Thank you.
we're completely linked with practice.
Good.
All right, thank you.
All right, thank you.
You're welcome.
So next on the agenda is the Excel Award winner, David.
Thank you, Mr. Chairman. It gives me pleasure today to introduce you to our December 2017 Excel Award winner, Merit Solers. Come on out, Merit. Close, come up and correct me, please, because Solwards. I'm not going to think of that. Congratulations. Okay? Congratulations. Come stand by me. Make me look good, okay? So, Merit is our December Excel Award winner. She is a quality specialist in health information management services and has worked at Sarasota Memorial since 2012. We've been fortunate to have Merit at SMH from the start of her career as a student intern. She transitioned to a full-time health information technician, then to quality specialist. And here's some quotes. Merit's knowledge and patience with everything related to HIMSS is impressive. One of her coworkers said, "You can always count on her to help out her colleagues." In addition to assisting with projects, Merit helps train new staff and students and provides physician training for dictation and chart completion. She's currently working with the SCI team and set up and trained community physician offices. Merit serves on the Florida Health Information Association Program Committee. She's an alternate IRB member and a contributing member of the GME Newtown Program Project. Her coworkers confirm Merit tackles every task with energy and with precision, excellence, and professionalism. This includes her achieving her bachelor's degree, registered health information administrator certification, and master's degree while all working at SMH. Thank you, Merit, for everything you do.
Thank you so much.
We very much appreciate it.
Thank you.
So hold on. Someone invite Susan to come up and-
I'm going to read your award and it's an honor to do this for you. On behalf of the board, I'd like to read this. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. So Merit, on behalf of the board and the hospital, I'd like to present this award to you. It is signed by our CEO, David Verinder, and the chair of the board, Joseph DiVirgilio. Thank you. Thank you so much.
So, Merit, so we'd like you to say a couple words if you're okay with that.
Okay.
Did you have any idea I was going to ask you to do that?
No.
Okay, well, I'm putting you on the spot.
Oh, I appreciate that.
Okay, I
Thank
knew you would. You look like you do.
I appreciate that.
I was truly stunned by this award. Teresa, Michael, I was actually not here when the management council met, so she had got me before I left on vacation. Hard life, I went to Jamaica for a golf tournament, so that part was nice, and came back to this, which was an utter surprise. I really enjoy working here. I'd come from a family business, so medical transcription was our background. So transitioning here was very, very easy, and I've got a lot of people that I truly enjoy working with. So thank you so, so much. I appreciate it.
Thank you, Merit.
All right, so I'm going to take this back from you. I'm going
Okay.
to trade with you.
Okay,
We're going to have you come to Management Council, and I'm going to give you this,
okay.
and then you need to pretend to be surprised there.
I can do that.
Okay, all right. Thank you so much. Congratulations.
So next on the agenda is the report of the medical staff. Dr. Garner.
Yes, nothing significant to report other than the fact that we're continuing to work to get our physicians flu shots and tracking down that. But other than that, there's nothing significant to report.
Okay. Thank you, Dr. Garner. Any questions for Dr. Garner? Okay. Next on the agenda is our foundation report. Mason Ayers.
Thank you, Mr. Chairman. I got some exciting news to report this afternoon. The Healthcare Foundation has just kicked off a new campaign called Give Gratitude. The Give Gratitude campaign gives patients at SMH the opportunity to make a gift in honor of a doctor, nurse, or other SMH team member for the extraordinary care that they provide. Patients can support SMH and say thanks to a doctor or nurse for the great care they received, or the cheerfulness a housekeeper provided, or the excellence of a volunteer. In addition to providing brochures that we're going to be placing throughout the hospital around the Give Gratitude campaign, we also have a dedicated website that patients can visit, where they can honor that caregiver. They can also share a personal story of thanks. And we also have patient testimonial videos on the website. During the holiday season, the Give Gratitude program is a great way for the community to make a gift and say thanks for the excellent care that SMH provides each and every day. If you're interested in visiting the website is smhf-givegratitude.org. Also, just one final note, January 13th, you haven't marked your calendars already, it's our hospital gala. It's going to be at the Ritz-Carlton. We have a big crowd of the community going to be there with us on the 13th, and the proceeds that evening are going to the SMH trauma program. That concludes my report, Mr. Chair.
Okay, thank you, Mason. Very good. Any questions for Mason? Okay, thank you. Next on the agenda is the Secretary's report. Susan Tucker.
Thank you. I'm here to report Sarasota Memorial Hospital's board calendar for the month of January 2018. Thursday, January 4th, 2018, from 9 a.m. to 12 p.m. will be the Mission and Planning Committee. Tuesday, January 16th, 2018, from 9 to 10:30, Joint Finance and Audit Committee will be held. From 10:30 to 12 will be the Quality Committee. From 12 to 12:30 is peer review. From 12:30 to 2, board lunch and issues and financial review. And from 2 to 4 p.m., the public board meeting will be held. That concludes my report.
Okay, thank you. Very, very good. Any questions for Susan? Okay, next on the agenda is the Treasurer's report. Sharon Wetzler DePeters.
Yes, this is item 10A on the agenda. I move approval of bad debts in charity care for the month ended November 30th, 2017 in the amount of $15,834,000.
Okay, we have a motion and a second. Any discussion? Motion. All right, thank you. And we have a motion and a second. Any discussion or comments? Hearing none, all those in favor, please indicate so by saying yes. Yes. Any opposed? The motion carries. Thank you. Next on the agenda, the financial highlights. Bill Wojcik, our CFO.
Thank you. Good afternoon. I have the financial highlights for November, and we'll start with operating revenue for the system. For the month of November, $65,544,000 compared to a budget of $60,854,000. Fiscal year to date, and this represents 2 months of activity, $129,222,000 compared to a budget of $122,554,000. The system's total expenses for November, $64,446,000 compared to a budget of $61,381,000. Fiscal year to date, total expenses of $127,940,000 compared to a budget of $124,518,000. The system's operating income in the rating agency format for November, $4,466,000, which generated an operating margin of 6.4%. And this compares favorably to the budget of $2,823,000. We had budgeted for an operating margin of 4.3%. Through 2 months of our fiscal year, our operating income, $8,003,000, which is an operating margin of 5.8%. And this compares favorably to the budget of $4,737,000, which budgeted operating margin through 2 months of 3.6%. Looking at some of the statistics for the hospital, our average daily occupancy, 490 patients, and this is through 2 months of activity, compared to a budget of 479 patients. The acute length of stay on average, 4.38 so far this fiscal year, and this compares to we're slightly lower than last year's 4.44 days. On admissions, so far we've had 5,805 compared to last year budget of 5,262. Our surgery cases through 2 months, 3,893 compared to a budget of 3,503. And so far, we've had 634 births compared to a budget of 541. On outpatient registrations, so far, we've had 75,234 compared to a budget of 68,483. And emergency care center registrations, 20,228 compared to a budget of 19,459. And through 2 months this fiscal year, our case mix index for all patients is 1.82, and for Medicare patients, 1.95. Mr. Chairman, that concludes my report unless there's any questions.
Okay, any questions for Bill? Thank you.
Thank you.
Thank you very much. All right, next on the agenda, item 12, our committee reports, starting with the Human Resources Committee, Jim Meister.
Thank you, Mr. Chairman. On December 14th, the HR Committee of the Board met. First on the agenda was a review of the system's policy against harassment and discrimination. Next, the committee reviewed the performance of the system and Mr. Verinder for the past fiscal year. The committee reviewed a number of different areas, including the system's national indicators of excellence on quality and patient safety, the ways in which the system has expanded and adapted to ensure the community has access to top quality care, and the system's sustained positive financial performance. Additionally, the committee reviewed Mr. Verinder's exemplary community, professional, and advocacy efforts and involvement. And I have a motion following that review and discussion of the committee. The committee recommends that the board approve Mr. Verinder's Smart Plan Leadership Award for the year 2017 pursuant to policy, and set his base compensation at a blend of the 75th percentile of the independent hospital and health systems, and his Smart Plan Leadership Award at the maximum of 32.5% for year 2018.
Thank you. So we have a motion.
That's the motion, yes.
And do we have a second?
Second.
All right, we have a motion and a second. Any comments or discussion? Hearing none, all those in favor, please indicate by saying yes.
Yes.
Yes. Any opposed? The motion carries. Thank you. Right. Jim, does that conclude your report?
That's it. I'm sorry. That completes my report, Mr.
Okay.
Chairman.
All right, thank you. So next on the agenda is mission and planning, of which I am the chairman. So, Jim, I need to temporarily turn the gavel over to you as chair so that I can give the report from mission and planning
Please.
meeting held earlier today.
Thank you.
So, David Verinder, President and CEO, presented 2 properties located at 1705 and 1717 South Osprey Avenue. Both properties are listed as medical office buildings with a total land size of 18,758 square feet. They're located directly on Osprey Avenue at the corner of Osprey and Hawthorne. The buildings are situated on the western side of the Sarasota Memorial Campus. Mr. Verinder detailed that the intended purchase of these properties would allow for improved site planning, construction, and access to the new west parking garage. Following board approval, Mr. Verinder stated that there would be a 30-day inspection period and a 30-day closing period, with an anticipated closing date to occur no later than March 2018. The plan to purchase these two properties was approved by the Mission and Planning Committee this morning. So I have a motion. I move approval of grant of authority to administration to execute such documents and take such steps as necessary to close the purchase on the properties at 1705 and 1717 Osprey Avenue for a combined total of $2,005,000 plus closing costs and other related fees as recommended by the Mission and Planning Committee.
We have a motion on the table. All those in favor?
Yes.
I'll take a second.
All those in favor indicate by yes, and as opposed, the motion carries. We didn't vote.
Yes.
All those in favor, please respond by yes.
Yes.
All those opposed, no. Hearing none, the motion carries. Thank you, Mr. Chairman.
All right, thank you. So I'll take back over the chairmanship. Thank you. So next on the agenda, the President's report, David Verinder.
Thank you, Mr. Chairman. So this is my regular monthly report. I'm going to start like I always do with our organizational report card. Today I'm reporting on our year-to-date status for 2018 through November. As always, we'll start in our service pillar and look at our HCAHPS scores. We have a goal of being 8 out of 11 at the domains at 50%, at or greater than 50th percentile. Happy to report that we are exceeding that right now and hitting 9 out of 11. I'll show you the detail on that in a minute. We also have a goal on our outpatient side at being 58 out of 58 domains at the 50th percentile or greater, and I'm happy to also report we're exceeding that. We're hitting 56 out of 58. In the people pillar, we have a goal of having our turnover of part-time and full-time hires that have been hired in the last 12 months at 25% or lower. I am going to tell you we've had a tick up in turnover in that category, and we're at 26.92%, so I have teams working on that. In the quality pillar, we have infection prevention, which is our combined overall standardized infection rate. We have a goal of being less than 0.95. Happy to report that we are exceeding that at 0.88. And once again, the national average or expected value being 1.0. In a finance pillar, as our CFO, Bill Wojcik, has already discussed, we have an operating margin goal of being 5.1%, and we're currently exceeding that at 5.7%. In a growth pillar, our first goal is our inpatient admissions and observation outpatients. We have a goal being at 38,899 or higher. We're exceeding that at 46,202. In our outpatient registrations, we have a goal being 799,000. We are exceeding that at 837,000. Looking a little closer at our service and our HCAHPS, you can see here the list of the 11 domains that are reported through CMS. And you can see on the far right-hand corner column, the green are the ones that we are exceeding at 50th percentile or better, and the other two we're falling a little bit short. Those that we're falling a little bit short are cleanliness of hospital environment and quietness of a hospital environment. Both two related directly to our private, semi-private rooms, which we do have plans and are working with teams to help mitigate that right now. Staying in service, SMH staff and friends each year give generously to this holiday season, and we do have a number of them that we're identifying and this time. We have Mothers Out Helping Mothers. You can see of our team members there giving things to mothers. We have our Bowls of Hope teams that are out. We have our Thanksgiving food drive, our Birthday Bear Lady annual donations, and our adoptive families, where different departments in the hospital adopt families. And really, staff really love doing this, each one of these type of things, and we appreciate their involvement in helping our community. So this year's Heart Walk was scheduled to take place the same weekend that Hurricane Irma struck Florida. And so, as you can imagine, we decided to cancel the event, having a Cat 4, 3 or 4 hurricane hitting the area. But it didn't damage the efforts to raise funds for American Heart Association. Team SMH raised $14,000 for the walk. A special celebration recently took place in the courtyard. So thank you for all the team members that showed up and doing that. Staying in quality, our NICU honored for excellent patient experience results. Our neonatal intensive care unit, or our NICU, was recently received the 2017 Press Ganey Guardian of Excellence Award for ranking in the top 5% of NICUs around the nation for patient experience. The NICUs, the NICU scores reached the 95th percentile for each reporting period for the award year. And you have a picture here of Judy Weisner, who is our patient experience manager, and the Press Ganey CEO, Pat Ryan. So appreciate everybody in the NICU making our patients' experiences what they are. I also had 2 nursing leaders win statewide awards recently. Congratulations to SMH nursing leaders who took top prizes in this year's Florida Organization of Nurse Excellence 2017 Excellence Awards. Women and Children's Services Director Pam Beitlich won the Director of the Excellence in Nursing Leadership Award, while Clinical Programs Manager Jackie Garabito earned Excellence in Preceptorship and Mentorship Nursing Award. So if you see either one of these young ladies around, please offer them your congratulations. Going into people, during Veterans Day last month, staff recognized the hundreds of employees, patients, and family who have bravely served our nation. SMH float nurse Annette Gargano, RN, and a U.S. Army veteran, continued her annual tradition of handing out special pins and ribbons. And it truly is hundreds of people who have served our armed services in our nation in this organization. We thank them all. Staying in people, I have a bit of an update on our quads that were born. SMH had a very special visit in November from the Corcoran Quads. The family of the thriving foursome stopped by to thank the talented team who helped them welcome them into the world and care for them in their early weeks of life. So great to hear Harrison, Preston, Jackson, and Lila are doing great. Staying in people, volunteering at Bowls of Hope. SMH corporate volunteers turned out at the annual event to help raise funds for the All Faiths Food Bank. SMH also provided its ever-popular Kick and Crab Chowder, who apparently is a secret recipe by Robert. You all know him. And maybe we'll have to get him to bring that soup in for the board one day. But it's a great event. Staying in people, we have our HEALTHFIT SPRINGFIT 5K. Registration for the March 31st SPRINGFIT 5K Run Walk is now open. Runners and walkers of all ages are encouraged to participate. The Kids Fun Run and Egg Hunt are free to children under the age of 10. Participate in the free multi-week training program starting Saturday, January 27th at HEALTHFIT. Learn more at an informational session on this January 24th at 5:30 p.m. You can always check our website for how to register and all the details around that. We recently SMH has selected our top-ranked firms to build our Laurel Road Hospital campus. Flatt Architects and Gilbane Building Company were recently selected to design and construct Sarasota Memorial 65-acre campus site on Laurel Road in Venice. The selection allows us to begin working on pre-construction and design plans while we await final approval from the state on our Certificate of Need application. we look forward to hosting neighborhood meetings and working with the city and the community down there in the very near future. In the growth section, we wanted to welcome two of our newest surgeons to the First Physicians Group, although they are longtime surgeons in this community, Dr. John Knorr and Dr. Russ Novak. Both recently joined First Physician Groups and converted their offices over. So welcome to both John and Russell. And our lung health clinic helps patients breathe easier. The program helps empower the lung disease sufferers to breathe better, improve their quality of life, and prevent ER visits and hospital stays. The clinic works with each patient's physician and other medical providers to create customized care plans and to address individual disease-related risk and complications. And with that, that is my report, Mr. Chairman. I'd be glad to take any questions.
Any questions for David? So, David, just in addition to the HR report that Jim gave, I'd just like to congratulate you on a fantastic year as the leader of the hospital system. Your commitment to the community and your pursuit of excellence, I think, across the board is obviously stellar and greatly appreciated. So, thank you.
Mr. Chairman, I appreciate those comments. I just want to tell you it's my everyday pleasure to get up and be here and to be part of this organization. None of this is possible without the team. And I'm fortunate to get to stand in front of you, but it's all the people that are doing the hard work behind me. But thank you for your comments.
Thank you.
Thank you.
Okay, next, consent agenda. I don't think we have anything. Okay, nothing there. Public comments, Karen? Okay, no public comments. Legal matters, back to you, Carolyn.
I have no report.
Very good. Any other business? Hearing none, we are adjourned. Thank you very much.